Dr. Lile, you're recognized. Introduce yourself. Give us your testimony.
Thank you very much, Chairman Hughes and the remainder of the committee members. My name is Dr. William Lile. I practice obstetrics and gynecology. I'm board certified. I've delivered over 5,000 babies, and I've been an instructor with both the University of Florida and the Florida State OB/GYN residency program, and it's an honor to be here today. We have a wonderful partnership between Florida and the state of Texas. We recently transferred one of our patients who was diagnosed with a condition called twin-twin transfusion syndrome, where she had identical twins that were sharing one placenta, but just like a lot of siblings, they weren't sharing nutrition equally. One was real big and one was teeny tiny. We transferred mom and both of her babies over to Texas Children's Hospital. They evaluated, confirmed the diagnosis. They then took them to the operating room. They took a camera called a fetoscope. They went through the skin of the mom's abdomen, went through the wall of the uterus, took the camera into the womb with both of the babies. They evaluated the vasculature of the placenta. They then deployed a laser and they cauterized the blood vessels and literally divided the placenta in two, essentially saying, this is your side of the placenta, this is your side of the placenta, knock it off, play nice. They watched them for 10 days. They sent them back to us. We followed them for the rest of the pregnancy. They might have started off like this. By the time I deliver them via C-section, they were almost the same weight. But we are now performing open heart surgery for babies on the inside of the womb, where babies have their own IV and anesthesiologist, and tumors are removed from the baby's beating hearts. We're doing vascular brain surgery, spina bifida corrective surgeries in its third generation. It's amazing how we are diagnosing, treating, and curing the babies in the womb. All patients have rights. We're doing blood transfusions to babies on the inside of the womb who are being attacked by the mother's immune system because they have often different blood types. We're even correcting heart arrhythmias for babies while they are inside the womb, saving their lives. But we have a tragedy which is happening. There's a danger to both women and moms, and that, of course, is the abortion pill. We've heard how it is being shipped right in here to Texas, and yes, it will kill a baby 98% of the time, up to 12 weeks gestation, but it's also dangerous for moms as well. There was a study that was released April 28th of last year, a study of 865,000 women looking at their insurance data, women who had been prescribed the abortion pill, and they followed them for 45 days to see if they had any complications. And what they found was of these women who had taken the abortion pill as directed, over 40,000 of those women had to go to an emergency room for a complication directly related to the abortion. There were over 28,000 women who experienced hemorrhage. There were 24,000 women who had to have an additional surgery, such as a D&C, removing leftover pieces of placenta or even leftover fetal tissue. There were 12,000 women who had to be treated for either infection or sepsis, and there were 3,000 women who had to be treated for an ectopic or a tubal pregnancy. An ectopic or tubal pregnancy is still the #1 pregnancy-related cause of death of women in the first trimester of pregnancy. When a woman is pregnant, 1 to 2% of the time, that pregnancy will be ectopic or tubal. My daughter just recently had an ectopic pregnancy. When a woman receives a abortion pill mail order and does not receive an ultrasound, 1 to 2% of the time, that will be an ectopic pregnancy, and the abortion pill will not be a treatment for them. Women are being harmed, but not only are women being harmed at a rate which is 10.93% as opposed to the 0.5% that we were told when the abortion pill was originally approved, 22 times more dangerous, but the abortion pill is being used as a weapon as well. In Illinois, where abortion is completely legal, a man was just sentenced to 7 years in prison for using the abortion pill to kill a woman's baby. In Louisiana, charges are placed against a man who used the abortion pill against his own 17-year-old daughter to try to kill her baby inside of her womb. She started having bleeding, cramping, and pain, was rushed to the emergency room, was taken to labor and delivery. She had an emergency C-section performed of a 20 3-week baby. That was 1 pound. The baby is still alive, but he has been charged with attempted feticide and also assault on the mom. Women in Texas deserve better. You've done such amazing things to protect the lives of moms and of women, and also to the babies on the inside. They deserve better. We do still not have either a urine or a blood pregnancy test to test for the presence of the abortion pill. When I was in Corpus Christi this year, there was a woman who was slipped the abortion pill in a cup of hot chocolate by the father of the baby. She then started having bleeding, cramping, and pain, and she passed an 8-week fetus with fingers, toes, and eyes looking at her. They were unable to prosecute because of lack of evidence, even though they had a credit card bill. But there is still no commercially available test to test for the presence of the metabolites of mifepristone, which would be something we could definitely use, because if a woman has a miscarriage, you really can't tell the difference between a spontaneous miscarriage versus having the baby killed by somebody else. All patients have rights. Patients not born in the United States have rights, and patients not born in the United States yet have rights. God bless Texas, and thank you for your time.